Thanks for checking out MassageBook's electronic soap notes. You'll love how they simplify the way you track and organize your client's progress. Each note is seamlessly tied to a client's record, so you'll always be prepared with key information that's just a click or tap away on your computer or tablet. In this video, we're going to show you how to create a soap note for a client, how to keep track of which notes you need to complete, and how to modify notes while keeping a full historical record of any changes. You can take a few different paths to create a soap note that we'll explore later on, but for now, we're going to start under soap notes in the client's record. In this example, service provider Jill is going to be creating a new soap note for her client Amy. Jill has two options on this page. She can select to create a new blank note, or she can select to copy Amy's previous note. We'll expand on that second option in a bit, so for now, Jill is going to select New Blank. Before we continue, MassageBook comes with two versions of soap notes, Basic and Premium. Premium soap notes include both note mode and draw mode that Jill is going to use in this video. They also give her access to client intake forms. Amy completed hers through email prior to her first appointment, so now Jill can easily review Amy's form, medications, and contraindications when she's creating a premium soap note. Everything else she's going to use on this page is available with the basic version. Down the page, Jill will see a fully featured soap note form complete with an anatomical chart that she can click on whenever she needs a refresher for how the body is put together. Jill is going to start by picking a date of therapy, the service and duration, and the service provider. In Jill's account, she can view a list of recent appointments that don't have a note on file yet, and when she creates a note through that route, the date, service, and provider will automatically be filled in for her. If you're transferring your old paper notes over to new electronic ones, you want to add those notes like Jill is doing now so that you can select past appointment dates. On the right side of the page, Jill can enter notes for Amy under each section of the form just like she would with any standard soap note template. However, Jill is going to use note mode to write her subjective and objective notes for this appointment. This will save her time and ensure that she adheres to a consistent structure for each note. But first, let's talk about the different ways Jill can view the anatomical chart before she adds a note to it. She can flip between front and back by selecting posterior and anterior. She can also drill down further into the body to see muscle names and additional views when she's in layers mode. All she has to do is select the layers button and then click on a section. Now that she's ready to add a note to the chart, she'll select the note button to switch over to note mode and then click on the part of the body she wants to document. Next, she'll pick subjective to begin filling out each section in the auto-create form based on what her client is experiencing. Amy recently strained her left shoulder during kickboxing class. It's not too painful, but it's been bothering her non-stop ever since. She's hoping Jill can help get her back to full speed. Once Jill is done and has selected save, her answers will be converted into a complete sentence back under the subjective section of the form. She'll also see a visual marker on the chart to help her easily remember Amy's condition at their next appointment. During treatment, Jill found some tender spots around Amy's right knee that are probably related to overuse while running, so Jill is going to add an objective note using the auto-create form as well. Just like the subjective note, a sentence will be added back under the objective section of the form and a visual marker will be added to the chart. Jill can also add her own visual notes when she's in draw mode. All she has to do is select the draw button and the layer that she is currently viewing will open up in a new window for her to draw on. Adding the perfect visual note each time is as easy as picking a color, choosing between the pencil, the circle, or the eraser, picking the size of the tool, and then clicking and dragging her mouse or finger across the body. When she's done with her masterpiece, a quick save at the bottom will add the drawing to the rest of her detailed observations. Prior to the appointment, Amy emailed Jill a doctor's note related to her injury. Jill wants to be able to easily reference it later on, so she can attach it to this note by selecting Upload File and then locating where it's saved on her computer. From here, viewing or removing it is just a click away. If she wants to just focus on the written notes, she can switch over to the Notes Only tab to hide the body chart. Jill can also view any existing soap notes and create new ones while she's in the MassageBook mobile app on her phone. The mobile version of soap notes mimics the Notes Only tab here, meaning that Jill can still add or edit written notes only when she's on the go. While she's here, she'll go ahead and add her assessment and her plan for Amy. Jill has two options when saving a new note for the first time. If she selects to save it as a draft, she'll see an alert in Amy's record about it being incomplete. This is useful when Jill is short on time and needs to add more information later, but since she has fully reviewed Amy's appointment and is prepared to move forward, she'll select Save to add it to the rest of Amy's soap notes history. Speaking of needing a reminder, Jill has had a busy day at the office, so to help her catch up on her work, she's going to start by looking at her list of recent clients that need new soap notes. She'll navigate over to her personal profile first, and then she'll go to soap notes. Here she'll see all of her appointments within the past 7 days that don't have a note on file yet. Pete was the last appointment of her day, but she hasn't got around to updating his progress. She has the option to create a new note like she just did for Amy, or she can create a copy of Pete's previous one. Earlier we talked about the difference between basic and premium soap notes. Only premium includes the ability to copy a previous note. When Jill selects copy, the notes and drawings from Pete's previous appointment will automatically be added to his new note, but the date, service, and provider will be filled in for his most recent appointment. From here, she can expand upon the note based on how the new appointment went. While we're on the topic of editing soap notes, whenever Jill modifies an existing note, the revision history is tracked so that she can keep a full historical record of any changes to that particular note. This ensures that her data is securely saved and compliant with HIPAA guidelines. She just remembered a few things about Amy's assessment that she forgot to write down, so she's going to go back to soap notes where she can quickly find and open Amy's under recently created notes. Then all Jill has to do is select Edit, add her updated notes to the assessment, and save her new changes. When Jill reopens the note, she'll be able to view the current version and any previous revisions by selecting the date in the drop-down menu. And lastly, let's fast forward 2 weeks to Amy's follow-up visit. Jill can easily prepare for her day right from the schedule. All she has to do is open Amy's appointment and then select soap notes where she can quickly pick up right where she left off. Say goodbye to paper soap notes for good, keep better records, and join Jill today.